Milad, welcome to the show.
Thanks.
Pleasure to have you on. To kick us off, tell me a little bit about what you do at See-Mode and how the world's going to look different if your mission plays out the way you hope it will.
Sure. So at See-Mode, we're working on the problem of stroke prediction. A stroke is sadly one of the biggest killers in the world. It's the second biggest killer in the world, and it affects 15 million people a year. So any stroke carries a chance of death or disability, more than 50% chance of death or disability. It's pretty devastating, but unfortunately, the way that a stroke is managed now is pretty ineffective. There are some critical risk factors that are missing, and clinicians need those information to make a good judgment about their patients. And that's exactly the gap that we're trying to fill at See-Mode. So what we're doing is that we are analyzing existing medical images from patients, from routinely collected scans, nothing fancy. And out of these images, we're actually giving objective information to clinicians so that they do not rely on their own guesses or hunches about what treatment the patient should get. They can actually make an objective decision to make the right choice, whether it's surgery or aggressive medical treatment. That will actually help the patient and prevent a deadly stroke from occurring.
Tell me a little bit about, so most listeners probably won't know the specifics of how a stroke happens, but talk to me a little bit about what the dynamics of the problem actually are and what you need to know, which two fields you basically need to combine in order to create a solution to the problem.
So that's a pretty interesting story. My co-founder and I are coming from very different fields. So I'm coming from a background in fluid dynamics. I did my bachelor in mechanical engineering. I did a PhD in applied physics. Everything was on fluid dynamics. Sadaf, on the other hand, my co-founder, she comes from an AI machine learning background. Two very, very distinct fields. They don't really merge with each other anytime. So my co-founder, Sadaf, had this interview with this big shot neurologist here in Singapore, one of the most famous neurologists actually here and around the world. She comes back home at 8 p.m. and we start actually talking about the problem because half of the words that the neurologist used was on her background and the other half was on my background. This is super strange. We start talking about the problem, we start reading literature from 8 p.m. to like 4 a.m., reading all of the papers that we can find on this, and we figure out that, we can actually do something on this together. But we didn't really rely on the answer that we got from one neurologist. So after that, we went around and actually spoke to 50 more doctors here in Singapore, in Europe, in the US, called emails to the head of vascular surgery in whatever hospital, whoever took our calls and took a meeting to validate whether the problem actually exists. This problem with stroke prediction, make sure that the risk factors that we're providing are actually useful to doctors. And when it happens, it can actually make an impact on what they do. After we verified that with 50 more doctors, then that's when we started working together and broke up our previous teams in EF.
Yeah, so talk to me about that. You obviously didn't actually join the program with the intention of working on an idea together. What were you working on initially? And what was Sanaf working on as well? And then how did you sort of navigate the process, obviously breaking up and then starting working on this?
So I was working on some natural continuation of my PhD work. So it was again related to fluid dynamics, but for minimally invasive surgeries, which are some fancy types of surgery where you go into the blood vessels of a patient with a tiny fiber optic to do surgery somewhere. I was working on that, and Sadaf, on the other hand, my co-founder, she was working on AI and machine learning for ultrasound images. So she was closer to what we're doing now. But after she found out about the problem, that's when things changed. We actually slept on it for a couple of days to make sure that this is in fact a valuable problem, so that it's worth breaking our teams up and actually joining together. Initially, I thought that, this is like an emotional thing, breaking a team up. But when I spoke to my ex-co-founder, they were pretty cool about it. Yeah, it's an opportunity cost for both sides if they're not committed to the idea. So far, I think we're all very happy with the decision and the commitment. Yeah.
Of course, you've got a more interesting co-founding relationship than most people because, of course, you're married to Sadaf as well. How do you manage the process of, on the one hand, being married and the other hand, running a business together?
Yeah.
You must get asked that a lot.
We are married, but we didn't start the company because we were married. That was very important to us. We didn't come to EF thinking that we would do a company together. Since starting the company together, we've tried very hard to actually make a distinction between Milad and Sadaf as co-founders and as husband and wife. It's essentially not taking the challenges of work back home and vice versa. I'm going to be very honest. This is a very difficult thing to do, but so far we were quite successful in it. One more thing that I think I should mention about this is that it comes with a lot of positives too. Sadaf and I are very close to each other, and doing a startup actually takes a toll on any founder. It takes a huge part of their life. If we didn't spend that time together, it would have taken a toll on us as people, as husband and wife. So being together in the company and spending all of this time next to each other is actually helping us on that front. We're quite positive about the whole experience. We try to be supportive of each other all the time, even though there are sometimes, like as any founder, there are mistakes happening from any side. We try to not mix it with the personal life, and find the best way to actually move forward.
Sure, well, pleased to hear it's working out at the moment, and long may it continue.
I hope so.
What made you decide to join EF? You know, we were chatting before we started speaking about your background in academia. Obviously, I'm sure that you were seriously interested in what you were doing, but something obviously wasn't enough. Why did you want to start a company?
The main motivation for me coming out of academia and into the startup world was that I wanted to see my research being used. I wanted to take what I'm building, or even a simpler version of it, outside of the lab and get it to the hands of someone to use it. This unfortunately doesn't happen very often in PhDs or in academia. It's an honest statistics that quite a lot of PhDs get demotivated just because of this. They get discouraged. My main motivation was building something that, even though it's technically complex, it's creating impact and value in real life. Having said that, I've learned quite a lot during the PhD, both me and my co-founder. There are a lot of useful skills that you learn during a PhD that directly can be used in a startup. You learn how to be resilient, you learn how to solve tough problems without giving up, you learn how to be thrown into a blank canvas of nothing and actually create something around yourself. That's sort of similar to what you do when you're starting a thesis during a PhD. On the other hand, there is a very big difference between doing research in academia and doing R&D work in a technical startup, like what we're doing. A lot of what we do right now at See-Mode is still research. It's very hardcore R&D work. Being very honest, we're actually genuinely pushing the boundaries of science in our field. We're doing new research, we are publishing that research as well, similar to what academics do. On the other hand, there is a big difference. We're doing that research not to publish papers, because it's needed to make our product work. And that's the main difference. In academia, there is quite a lot of publish or perish culture. What we're doing in terms of publishing is just publishing the amount of effort that we went through to make a product work. A product that is not intended for researchers, a product that's intended for clinical use. Yeah.
Very exciting to see it being applied in the real world, and that real motivation of, hey, when we make this breakthrough, actually, we're going to be able to apply it to solve this huge problem, obviously, that you're working on. Tell me a little bit about your upbringing. Do you think it influenced your decision to become an entrepreneur later in life?
So I'm Iranian, and my co-founder Sadaf, she's also Iranian. There is one personality trait that I think Iranians actually naturally develop that is directly translatable to doing a startup. We learn to be resilient and we learn to be tough. In order to succeed in what you do, nothing is handed to you in a silver platter. So you have to work pretty hard for it and not give up. And I think that's pretty translatable to doing a startup. It affects how you tackle a big problem, how you break it into small chunks. Yeah, I think it's a very useful skill that I got from my upbringing into the startup world. Something I want to add about what we do at See-Mode, maybe it's especially related to the first question that you asked about, like the impact that you're making, is that what we do at See-Mode, predicting stroke, is a medtech moonshot. Maybe it doesn't really sound like a moonshot to people who are not familiar with the domain, but when you're talking about a disease that affects 15 million people a year, when you're talking about the second biggest killer, you are talking about a moonshot. One thing that we're doing at See-Mode, and it's a combination of what we've learned through the PhD, through the upbringing that we had before we started the company, all of that is we are breaking that moonshot into small chunk-sized products in a pipeline that sit nicely next to each other. But when combined, they actually allow us to get to that moonshot. If you talk about predicting a stroke without breaking it into smaller problems, you have no viable path to take. What we're doing is that we're breaking it into small chunks. Each chunk is a product that is valuable on its own, solves a problem for a group of customers, but then putting them next to each other, actually resolving a big problem.
So tell me a little bit about where you are in that pipeline at the moment, and who are you serving at the moment? What specific problem within that longer term frame are you doing?
Sure. So a bit of technical information about See-Mode. So we analyze all modalities of medical images that are routinely collected from stroke patients. So that would be ultrasound, MRIs, and CT scans. And with each modality, we do different stuff. On ultrasound, fortunately, we seem to be ahead of our roadmap, the one that we projected during the EF. Things have moved pretty fast. So hopefully, by the end of the year, we would be able to launch our first product for early customers to use. And that's a pretty fast timeline for a medtech startup. In the product pipeline of any medtech company, actually, in product development of any medtech company, what is important is that there are no shortcuts in terms of gathering clinical evidence that the product works, and for good reason. It's affecting patients' lives in future, so you have to be very careful. One thing that we are very focused on seed round and after fundraising is we're gathering the clinical evidence that is needed to show that our product works and our claims are all correct. We're going through a very rigorous product development and clinical study process. We do product development, we engage with hospitals, with neurologists, with clinical scientists, validate it, check our assumptions, and go through the process again. Having said that, we do this with a speed that is not very common for an academic environment or for a big company. We have iterated very fast on our first product, and the results are actually better than anything in the market. So that's how we can hopefully release it soon this year.
Has that been a challenge, even with the people that you've been working with? So have people been surprised at how fast you're able to iterate and come back with something different and say, like, hang on a minute, what are you doing? You know, does it shock some people?
Yes, it does. One of our main clinical advisors is a young neurointerventionalist here in Singapore, and he's always asked by companies, by research groups for data, for clinical data, for collaborations. Fortunately, we were one of the attractive ones for him, and he started working with us. And since then, he's continued to work with us pretty much all the time. We ask him questions on WhatsApp at any hour during the day, and he tries to help us. Our investors actually asked him, why do you engage with this company so much? Why are you interested in helping them develop their product? One of his answers, beside believing in the product, was that they iterate very fast. They're moving faster than any other company or any other group that I've ever worked with. So that also excites them, the clinical advisors, that the effort that they've made in data collection, in clearing up this data that can be used to create an engineering product for their work, is actually paying off by working with a company that's trying to do good by it and do it quickly.
Yeah, as you were saying before, what you're doing, you really are working on a medtech moonshot, and obviously you need people to help you fulfill that. How are you and Sunaf thinking about bringing people on board now as you're starting to make hires for different positions within the team? What are you looking for? What processes are you using to filter for the types of people that you want on board?
Oh yeah, so hiring is very interesting, and one of the challenges that we didn't really think of before. It surprised us. I'm going to make a very contentious point. CVs lie. I don't mean that people lie on their CVs. I mean that looking at resumes and CVs, it lies. It doesn't really tell you about what the person can or cannot do. We figured that out, fortunately, very soon, before we made our first hire. And the way that we are gathering all of these fantastic engineers and technical people in our team is we design a hiring process specifically for any core team member that we hire. By that, I mean before we go through the hiring process, we have a very detailed view of what the person would do in the team and where they fit, so that we don't ask for skills that are not needed, and we only ask for the skills that are needed, but to be very, very strong. On top of that, something that's very important to us, and all of the core team members have gone through, is a tech task. And it's not some random programming test we get from the internet. We essentially sit together in the company, and we design a tech task that's very similar to the employee's first day at the job. If they can do that, and if they can do the bonus part of the tech task, which is like going above and beyond, then we know that the technical skills of this person is actually good for the company. If they can't, we're a startup. We don't have the luxury of big companies to hire people and start training them through the process. It sort of delays the speed of the company. So the tech task is something that we found out works pretty well compared to resumes. I can give you a funny example. Our first hire, delete that. I can give you a funny example. We had 2 applicants for a position. One of them in the middle of his master's degree, a student. Another one, someone with 9 years of experience in that field, who was a tech lead in that field for 2 years. Who do you think performed better in the tech task?
I'm guessing it's the master's student.
The master's student not only performed better in the tech task, he solved the bonus part that we didn't really ask for and sent it to us the day after. So that's the type of engineers that we want in the team. People who get excited by the problem, and without us asking them to do this A, B, C steps, they actually go ahead and develop it on their own.
I was going to say, how important as well is it for you to have that kind of sense that the person really resonates with the problem that you're trying to solve as well, and that they buy into the vision? Because obviously it's a startup. You need a lot of people with all hands on deck. I imagine that must be front of mind for you.
Yeah, so we usually start the interviews slightly the opposite. We start pitching to the person about the company and the product to figure out their reaction, whether they get excited by hearing what we work on, whether they ask the good questions on what are the challenges. And after that, after we figure out that this person is actually excited about what we're building at See-Mode, that's when we start asking them about themselves, and go through the whole interview process. Yeah.
Are there any parallels between that and the fundraising process, in the sense that are you also looking for certain specific qualities in the investors, that they're buying into what you're doing, and that you get a sense that, you know, their heads and their hearts are in the same place as yours?
Let me tell you some stories about our fundraising process. I think it would be interesting. I think it's a common story. Fundraising, I'm going to be very honest, fundraising started a bit slow and difficult, as it is for, I think, quite a lot of companies and founders. It's pretty difficult to pitch something that is very complex to investors who have a little amount of time and they are hearing about it for the first time. Part of it was us improving ourselves through the fundraising process to make the pitch shorter, simplified, more exciting for the investors. But I completely agree with you. There are different types of investors for different entrepreneurs. Sadaf and I are very dedicated to what we do in the company. On the other hand, we're coming from academic backgrounds who are, I don't think, very well known for being the best salespeople. And pitching is sort of selling. So it was difficult to switch the hat and become a good salesperson during the process. But our investors also understood that. So our current investor, actually, in the first pitch, he tried to help me be a better salesman to him and pitch better to him. So that is the type of investor that we feel like we would work on. Someone who sees the challenges, but also tries to, even during a pitch process, tries to help you improve in pitching, yeah, and becoming a better salesman.
Yeah, it's very cool, and obviously a skill that you have to master, but you can certainly improve with over time, and meeting after meeting after meeting, I imagine.
Funny story, if you asked me like 6 months ago to do a 1-minute pitch of the company, I couldn't do it. The company didn't change. I just naturally went through the process and developed it, because it's just one of those necessary skills when you're leading a company.
Yeah, part of getting the bigger vision into a reality. What drives you? What gets you up in the morning? Obviously, you know, we've spoken about the scale of the problem, but on a personal level, like, what really resonates with you? How do you think about it at the times when, you know, you're tired and there's this big problem and you've got, you know, a million different fires to put out? What gets you up?
Well, I can give a couple of answers to it. One thing that drives me and drove me outside of academia to go ahead and start this was that I wanted to build something that's technical. I wanted to build something that's technically complex, but it's useful. It's helping someone. It's making an impact. I wanted to take the research, the skills, the knowledge outside of an academic lab environment into the real world. That just makes me feel fulfilled. There is one more thing about doing something medical, though. So Sadaf and I, we both started working on medical problems. We didn't start a company together, but we started working on medical problems. The reason for that is that maybe it sounds a bit cliche, but it's completely true. If we see that our product helps one patient, a single patient, we are personally happy. We're happy people. And that is just priceless. The way that this product and the company is just naturally designed is that if it can help that one patient, it can scale up and help 15 million more patients. So we didn't really start thinking about how can we impact 15 million people. It's a product that can fulfill what we were looking for, which is building something medical that's new, that isn't there, that people haven't really worked on before, and makes us happy by helping maybe just one patient.
Yeah, that's an awesome note to end on. Milad, thank you so much for coming on. It was great chatting to you.
Same here. Thank you very much for having me.